People who are 65 years old and up are most at risk of contracting COVID-19, as we've been reporting. The likelihood that they will die after being diagnosed is even higher. But despite what you may have read on social media, anyone can get the virus. Earlier this week, a 17-year-old in California became the first child to die from the virus here in the United States. Closer to home, an 11-year-old has been diagnosed here in Duval County, and a child as young as 2 is being treated in Alachua County. We know a 14-year-old also died in China at the height of the breakout there. Dr. Jeffrey Goldhagen is the chief of community pediatrics at UF Health, joining me now to explain the risk to our kids. Doctor, good morning. Thank you for joining us. Appreciate it.
Good morning.
So we know kids are home. In fact, I've noticed in my neighborhood, parents, they're letting their kids go on play dates. You know, the kids are bored. They finish their, home learning and they want to get outside and they want to play with their friend. Is this a good idea?
No, children are at risk. It's unclear as to the extent of their risk compared to adults, but they are certainly at risk. And so they need to be socially isolated the same way that adults are socially isolating. The issue with children is that they seem to be less affected as far as symptoms are concerned and may be what we call asymptomatic carriers. But during the time that they are asymptomatic, they can still be shedding the virus. And adults may be unaware that, in fact, a child is, in fact, shedding and at risk of spreading the disease.
Which I think brings up an important point, too, because we know for those parents who are essential to their work environment and have to go to work, they may be leaving their children then home with grandparents or older people in their family. And as a result, because these kids could have gotten this virus because maybe they're socializing more than the adults are, they could be passing it on to grandparents and not even know it, right?
That's exactly right. In fact, that's exactly the situation that we're in here in my home. And we're very, very careful to socially isolate ourselves, but in particular, our granddaughter who's 3 years old. The other issue is that, in fact, although children are less symptomatic than adults, it seems, that data coming from China seems to indicate that upwards of a third of children who get the disease may in fact exhibit significant symptoms, including pneumonia and other lung issues. So it's not as if children are immune from getting the disease, and it's not as if that they are immune from becoming symptomatic. We need to protect our children for multiple reasons, one of which is because we don't want them spreading the disease. The second of which is we don't want them coming down with the disease.
And it's interesting because we like to think that all children are perfectly 100% healthy, but the reality is, some of them have underlying conditions, some of them may be undergoing cancer treatment and other things. The kids who are considered at greatest risk of being hospitalized, who are those in terms of the kind of conditions they might have?
Well, we know that upwards of 5 to 10% of children actually suffer from chronic illnesses in our community. So children who are immunocompromised for any reason, including cancer or other diseases like juvenile rheumatoid arthritis and other diseases. So children who are immunocompromised, children who are being treated for cancer or receiving other immunotherapy treatments, children with chronic diseases, children with asthma. So there are groups of children that are at higher risk. In general, the response from parents should be to socially isolate. Now, there are lots and lots of websites now that are up and running to help parents deal with the social isolation of their children. One of which is the Fred Rogers website. And so there's lots of available information as to how to play with children. And it's critically important for parents to know that play is an important part of development of children so that they can take the opportunity now to play with their kids, go on the websites, find different things that they can do, and make the best of this time, but children do need to be socially isolated.
Pediatrician Dr. Jeffrey Goldhagen joining us over the phone via Skype. Thank you very much this morning. Important information. We've locked down my house because my daughter suffers from seasonal asthma. So, it certainly has us social distancing without a doubt. And I hope that more parents at home are listening to this so that their children don't get another person sick. And back quickly to that study also, Doc, thanks again, of pediatric patients in China. 6% of children who caught the virus developed serious illness illnesses compared to 20% of the adults that may not seem like, a lot. But ask yourself, do you really want your child to be in that 6%? You need to be practicing safe social distancing. We'll be right back.